All right, what's up, y'all? So, if you're watching this video, it's most likely because you have knee pain, know somebody with knee pain, or trying to help somebody get over their knee pain. Um, I created this video because I do not have knee pain, but I treated a bunch of people who do, from um, some common conditions like orthopedic conditions like PFPS. This is like runner's knee, jumper's knee, knee OA. Like, I treated a bunch of older people with knee OA that have like knee replacements, and just thought, like, man, this thing is like never gonna get better. And I'm telling you, that is not at all the case. From what I picked up from my education at Columbia, as well as some continuing education courses, as well as just some things I picked up on my own. I'm going to give you guys the game, all right? I'm going to show you guys how to get over your knee pain in the most easy, most efficient way possible, all right? All right, here we go. Let's get this thing going. Cool. So there's no need for anyone to have knee pain. All right. Like, there's just no need for anyone to be in pain, to be sitting around, lying around, not being able to go walk outside with their kids, or go for a run, or, do anything, right? Especially if there's a way in which you can get over that. And I'm about to give you guys that way. Again, my name is Brando Lakes. I'm a doctor of physical therapy. Went to Columbia. It was class of 2017, right? And I'm still in New York City, like doing my thing here. All right. So there's really two different conditions that people could have. Like, when it comes to there are many others, but really, like, there's two that really stick out. And I'd say the other conditions very much look like these two, right? And that's why I'm kind of focusing on this. If you're new to my courses, you might want to go ahead and take some paper out, and a pencil or pen, because you're going to be learning a lot, right? And you might have to watch this video a couple of times. You might have to watch it with a loved one, so they can get a better understanding, if you haven't been able to watch it enough to where you can completely relay those messages. Anyway, the two conditions that we're going to focus on, one of them is PFPS, and the other is patellar tendonitis. Right, so it's on the screen. I don't want to insult your intelligence, but PFPS and patellar tendonitis. On the condition on the left, the PFPS, you're dealing with tight quadriceps. Those are the quad muscles, the muscles right in front of your thigh, right? And with patellar tendonitis, you're dealing with weak quadriceps, right? So the one condition, the quads are tight, and the other condition, they're weak. Some people, these are the really unlucky ones, right? Like, they're going to have both tight and weak quads. And that's because when muscle fibers are already at its shortest, right, when they're at their tightest, then they're not going to be able to function as optimally as they should, right? So, that's to say, if the muscle is length at its perfect length, right, then it could do its job. But if it's already like working, and you're trying to give it more work, it's just not going to work. And that's when people end up with both conditions. These two conditions can lead anyone to having some very, like, disabling conditions, right? Like PFPS by itself can lead to a lot of swelling. People are not going to want to walk. They're not going to want to sit. They're not going to want to do anything, because their quads, man, their knees are already so painful. It's just, you just don't even want to move, right? With patellar tendonitis, it's a little different. Like, you might be able to move around. So you could be very young, like in shape. You might have been, biking a lot, right? Or just running a lot, and then you try to switch things up, or maybe you go back to running or biking after, wow, cycling. After cycling, after you haven't done it in a while, right? And your knees are like, hold up, like I'm not ready for this intensity, right? And they're, relatively speaking, a little weaker than they were before. So that's how people end up with patellar tendonitis, right? So again, with the one on the left, they're getting this swelling because they got this tight quad muscle that's pulling on the kneecap. So you see in the image there, right? There's a little black line pointing at the kneecap, right? And the swelling is coming from really inflammation because that kneecap is now grinding against your femur bone. That's a problem because you don't want any grinding. So these people, they're going to be complaining of clicking, right? They might have some like stiffness, right? And that's why it's going to be hard for them to sit down, stand up and just move around because that kneecap is supposed to be going, directly up and down, but those quad muscles are so tight that it's pulling that kneecap up, stays up, and it's just rubbing, grinding, clicking up against that long bone, that femur bone, right? So that's how people are going to get swelling there. Most people with the patellar tendonitis, they're just going to have pain like right underneath the kneecap, like between your kneecap and your lower leg. They're going to be pointing right there, like, man, I can't get rid of this thing, right? And if these two conditions aren't resolved, they're going to turn into something much bigger, much major, like later in life, right? So you might have been able to say like, nah, I never had PFPS, I never had the, patellar tendonitis, but you had some amount of tightness in your quads, you had some amount of weakness in your quads, and that's what's going to lead to the following conditions. Following being patellar femoral osteoarthritis, tibial femoral osteoarthritis, right? So we're now looking at the underside of the kneecap. Remember, I said that the kneecap is going to be grinding against that femur. Well, after so much grinding, right, like you're going to see some wear or tear. You're going to see some degradation of that kneecap on the underside, as well as like on that femur, on that long bone. And this doesn't recover like that, right? So the treatment for those with the patellar femoral osteoarthritis, believe it or not, is going to look the exact same as those with the PFPS. PFPS, by the way, is patellofemoral pain syndrome, right? And again, you let that grinding continue. You don't do, the Brando method, the kinesidelic method, then you're going to end up with some patellofemoral pain syndrome, right? Sorry, with some patellofemoral osteoarthritis. The case with the tibial femoral osteoarthritis, you're now looking at that there's so much weakness in your quadricep muscles that the femur is now putting so much pressure on the tibia, right, or your lower leg bone. Now, don't get me wrong, this can come from like an accident. You might have gotten like hit by a car. I've treated some people who like slip and fell, skiing, snowboarding, right? Like any sort of traumatic injury could definitely lead to tibial femoral, like tearing your ACL, tearing your MCL, like all those things, tearing your meniscus. That's the easy one, right? Like all those things can eventually lead to tibial femoral osteoarthritis. But notice this, anytime after an injury, you're going to be putting less pressure on that leg. You're going to be using it less. Most people, unless you're Adrian Peterson, right, or Tom Brady, you're going to start to treat that knee a little bit differently in a negative way to where it's not, getting that same sort of stress as the other leg, right? Like you might be taking it easy, and that taking it easy is going to cause that quadricep muscle to weaken, right? So again, you're still dealing with the after effects of a weak quadricep muscle. So when I'm treating these patients, I give them my kinesiodelic method, I give them the Brando method, and they're not getting those symptoms. And that's because the quadricep muscle is your primary anti-gravity muscle, right? Second comes the gastrocs, and third comes the hip extensors. Those are going to be your glutes. But yeah, your quads are your primary anti-gravity muscles. So if those muscles are firing on all cylinders, then that space between those two bones, right, that femur and that tibia, there's going to be a little bit more there to where there's less grinding, right? There's going to be less swelling. There's going to be less pain. But you have to build up the quadricep strength. So again, some people have both of these conditions. What would you do, right? Would you go straight to strengthening the quads? Absolutely not. Nope. You have to start at loosening up the quads, and that's what we're going to get to next. So it's really like a slippery slope that people go through, right? Like they get this pain or have this pain, maybe from doing this job. They have this constant wear and tear. They're beating themselves down, or again, they might have a very traumatic injury, right? And then they have pain from either the injury itself or post surgery, and they just start taking things easy, right? Like they're like, nope, I'm not going to go for a walk. Nope, I'm not going to stretch out because that everything just hurt. All types of movements like just hurt. I'm not doing that, right? And that, what does that lead to, right? Like if you're not, if your muscles are already tight and you're afraid to stretch the muscle because it hurts, then what do you expect to happen? Right? There's going to be more tightness because you're not doing anything to resolve it. And the same thing can go with in terms of strength. If the muscles are already weak and you're having pain each time you try doing something, then what will happen? They're going to just grow more weak over time, right? And that's how some people could just go ahead and get the knee replacement, where I'm a full component. I'm all for getting what you need to get by, to survive. But if you don't need something, then like why get it, right? So that's kind of what I want to go over with you guys. Like you can avoid this slippery slope. Like you don't have to have pain and just live with it until doc says, all right, it's time for you to get a knee replacement. Because even then, you might still have some pain, right? And then you're gonna end up, talking to a friend or coming across my page, right? Finding out about the kinesiodelic approach, and you're gonna watch this video anyway. You're gonna have to do this whole thing, right? And like, damn, like I should have just went this way the whole time, right? So again, don't fall into the trap. Tightness will lead to more tightness, and weakness will lead to more weakness. All right. So I haven't talked much about the hip flexors, but get this: the quadriceps, at least one of them, is a hip flexor, right? I'm talking about your rectus femoris muscle, right? You don't have to spell this correctly for those who are writing this down, but the rectus femoris muscle, if you look it up, you'll see that it crosses the hip. It's attached to your pelvis, right? And it goes all the way down, right? It's going to connect to that kneecap. The kneecap is going to connect to your lower leg. So, when that muscle is fully tight, what are you going to get, right? That muscle is like fully contracted. Your hips are going to be flexed and your knees are going to be extended. So I'm going to save like half of y'all some time right now, right? For those who have, the patellar femoral pain syndrome, for those who have patellar femoral osteoarthritis, it could also be chondromalacia, if you guys I've ever heard of that. If your doctor has ever mentioned that, it's the same thing, just different name. But anyway, if that muscle is fully tight, that hip flexor is going to be shortened, right? So your knees are going to be closer to your chest and your knees are going to be extended. Excuse me. So I'm going to save half of you all the time here. For those with PFPS or Patellar Femoral OA, OA is osteoarthritis. Stop sitting, right? Stop sitting with your knees extended. That's it. That's going to save you so much time, really, because the more you do that, This is, you know, assuming that you are, right? The more that you do that, the more that muscle is going to get tight because you're just telling it to tighten the whole time, right? You have it resting in a tightened position. So when you get up to walk, it's just not going to feel good. It's just not. Same thing with like standing with your knees locked out. Like, please stop doing that. You know, squeeze your butt, bend your knees a little bit. You know, when you're just standing waiting for your coffee or something, you'll be doing yourself many favors. All right. For those with a weakness, right? They got the tibia femoral neoa, right? Like, this is not the one underneath the kneecap. This is one between the lower leg and the femur, the tibia and the femur. You're going to need to build up those quads, right? Same thing for those with the patellar tendonitis. You're going to need to build up those quads, right? And quickly, you know, because the more that those muscles are working, the more that they're going, right, then you're not going to have as much pressure between those two bones. You're not going to have as much pressure at that patellar tendon, right? That patellar tendon, I didn't get to this, but that patellar tendon is only irritated because you're pulling at it, or you're trying to do an activity where that muscle has to produce a certain amount of force, right, to go through that patella to extend your leg, and it can't, right? It's you're trying to drive 100 miles per hour with a golf cart, you know, like it just doesn't have that power. So you need to build up to that so that you can do so without straining your knee, without straining that tendon, right? So the muscle is going to be strong enough to not tear, right? But that the tendons are a little bit different. All right. So for those who don't know, you know, muscle fibers, they naturally tear after an exercise and naturally tear with activity. Tendons don't. Tendons are just there, like they're like rugged, you know, and they're going to be helping to pull on the bone, because you wouldn't want your tendons to be, you know, tearing little by little, right? Like with every activity, especially if they're pulling on a bone, because what happens if it snaps? What happens if it tears too much, right? So, you know, our bodies have been made up, you know, in such a way that we're really protecting ourselves. So you really have to protect that tendon by strengthening your muscles, in this case, the quads. So again, if both, right, then you got to make some room to grow those quadricep muscles, and then you grow them, right? So again, if you're having tight hip flexors, if you're having tight quads, you got to loosen that up before you do anything. You just do, right? Like you just can't, because again, if you tried strengthening your quads after they're already tight, then that's just going to lead to more pain. You're going to get more grinding, more clicking, right? Like it's just not going to help. So one thing you have to do, you know, going forward and making sure, you know, your quads aren't tight, you know, you need to see, you know, if they're tight at all, you know, like try doing a quad stretch. We'll get to that. Try doing a hip flexor stretch, you know, see how that feels. And, you know, if you can do that right without, you know, arching your back, if you can do that right without, you know, compensating, then, you know, go right ahead, start strengthening. But most people, I can't say most people have loose quads. It's just not going to happen. Nope, not in the clinic. If they're stretching the hip flexors and the quads, they're doing it wrong. If they say that they got weak quads, all right. So how do you know if your quads are weak, right? Like you might say, yeah, I got thick quads because I ride bikes, you know, all the time. Like my thighs are huge, right? Well, that quad has been conditioned to do one specific activity, right? So if you have been, you know, riding bikes, if you're going for, I don't know how crazy people be with bikes, but let's just say like 15, 20 miles, right? And you do that like 3 or 4 times a week, right? And then you say, you know what, I'm gonna start running. Maybe I'll do like a 5K, you know, instead of riding my bike today. Like you've already conditioned your quads, you've already conditioned your muscles to accept one type of activity, right? And cycling is non-weight bearing, meaning that there's no pounding, there's no pressure, going through those bones and muscles, right? And the activity is just different. You're getting that muscle to activate a certain way that's different from how you were cycling, right? So that again is going to require a different type of force, a different amount of force. And if you ain't got it, then it's going to be pulling at that tendon. All right. Again, you got the butt muscles and the calves because those are your second and sorry, that's your third and second primary. Wow, your third and second anti-gravity muscles. I'm so used to saying quads are your primary anti-gravity muscles. So that's the reason for the little blip. But you want to strengthen your calves because those are going to help your knees. They just act together. Most people when they do a little gas pedal, they point their feet down, they tend to extend their knees, right? So again, like they just work together, they just do. And it's the same thing for the glutes. Glutes are going to help you like with jumping, just standing up, like going up and down stairs, like that's what you need. And you can actually, I don't want to say cheat, but you can like use your body to where you can use more of your glutes than your quads and take some pressure off your knees. And we're going to get to that. So again, for those people who think, right, that they're doing, the right quad stretch, that they're doing the right hip flexor stretches, and they're like, nope, I don't feel anything. I challenge you to do this. If you don't know what pelvic tilts are, look it up and practice that. I want you to go ahead, for those who do know what a pelvic tilt is, go ahead and do a posterior pelvic tilt and get into any one of these positions, right? Like get into any one of those three positions on the screen. My personal favorite is the one at the top right. You see this woman, she's stretching her what is that? Her left quads, right? Like she has that heel pulled up toward her butt. She has a little tilt, right? Like you are going to feel a stretch in your quads. You're going to feel a stretch in your hip flexors like you just haven't had before, especially if you have this condition. And I say if you can't get into that position because you just can't like bend that knee back that far, right? You can't get that leg behind you, right? Then maybe you can like get like a stretch strap. But this is a stretch I do before I get out of bed, right? This is a stretch I do before I go to bed. So, from left to right, across the top of the screen going down, we have the woman here doing pelvic tilts. The reason for the pelvic tilt is this. Your body or your pelvis, as it connects to the lower back, it can be neutral. It can be anteriorly tilted or posteriorly tilted. When it's anteriorly tilted, your hip flexors are shortened, right? So again, that rectus femoris muscle I said is attached to your pelvis, right? The very top front of your pelvis. If that muscle is so tight, then it's going to pull that pelvis downward, and in this case, in a counterclockwise motion, right? And that's how people be standing. They get that like that pregnant woman stance. You know what I'm saying? Like when they bring the hands behind the low back and just like sticking it out, like that's what you end up with. And when you do that posterior tilt, you're automatically stretching the quad. Like that's just what naturally happens, right? So you tuck the tail in. It's a little cue that I give. You tuck that tail in, and now those the hip flexor muscles, one of them your quad, your rectus femoris, is going to be a little more on stretch, right? So now your hip is then in neutral. From there, you bring the leg behind you. Keep the hip in neutral. Don't arch your back, but you bring that leg behind you. Now your hip is in extension, which is opposite from hip flexion. You get that? So hip flexion, that knee is closer to your chest. With hip extension, that knee is further away from your chest. So you're bringing that closer to your back, right? So you're bringing that leg behind you. You're bringing that thigh behind you. And that's what the woman at the top right is doing, right? So she has that thigh. It's not in line with with her upper body. It's behind her upper body, and now she's bringing her foot up toward her butt, and she's gonna get, man, a crazy good feeling, especially if she's tucking in that tail, and I believe she is. But let's say like that's too much, maybe you want to start off light. You can lie on your couch, you can lie on your bed, get your shoulders like more on top of the bed, uh, or on top of the couch, and you let the leg that you want to stretch just fall off, right? You pull the other knee up towards your chest, and you try your hardest to like try to get that thigh behind you. You try to get that underneath you, right? And you bend your knee. You're gonna feel a stretch right there. Again, especially if you do that posterior pelvic tilt, right? Now, the closer you bring those knees together, the closer you bring those knees, in line with one another, right? Like that's how you're gonna get more of that stretch. Because one of those quad muscles on the outside of your leg, we're going to get to that in a sec, is called the vastus lateralis. Vastus lateralis. That muscle is going to help to pull that kneecap up and outward, like not to the point where it's being dislocated, but like it's going to be going up and out so much that it's going to be grinding against that femur. So if you can loosen that muscle up, really like all by itself, you're going to get like a lot of relief, right? But to do that, you have to bring that knee sort of inward, right? Like toward the other knee, and then bring it back. The woman at the bottom right, she has the posterior tilt, right? So she's stretching out her right hip. She has it behind her, right? It's not in line. It's not in line with her body. That hip is behind her, right? And she has that little bit of a posterior pelvic tilt. She's going to feel that right in front, right? Like right in front. But let's say that chair instead was behind her. Maybe she just had like an extra chair behind her to where she can bend her knee a little bit more. She can get the hip flexors and the quad, right? We're going to get to that in a sec. No matter what, though, no matter what stretch you do, you want to do this as often as you can. I know I say like at least 3 times a day. I feel like you can get like some moderate relief with that. But man, if you wanna do it, 10 times, go crazy, right? In terms of frequency as well as duration, I'd say 30 seconds. You could do this stretch while watching a movie. The whole Avengers Infinity War. You can do that the whole time. By the time you get up, you'll have a brand new knee. I promise you that, right? So again, do this as often as you can. You're gonna get some relief for sure. Here are some other stretches that I recommend for both patellar femoral pain syndrome as well as patellar femoral osteoarthritis, again, also known as chondromalacia. I have to point this out. The top left, again, like if that hip, if that knee is in front of you, then that quad is not being stretched. Many people get this stretch so wrong, and I hate seeing it because I'll be walking through the park with my wife and I'll be thinking I'm about to get the day off, but nope, I just get back into my exercise signs like physio mode, like kinesiodelic mode, and I'm like, man, I gotta help this guy. I gotta help this woman because they're not helping themselves right now when they're doing that stretch. They're just wasting time, right? So what this guy's doing, he's bringing that knee. He's trying to bring it behind him, but that quad is so tight. That hip flexor is so tight. I mean, he just can't. But that's the end game. Like that's the goal, right? You want to bring that thigh behind you to where it's not in line with your body, right? So from there, you want to bring those knees closer together. And again, you're going to feel the stretch right on the outside of your quad. That's that vastus lateralis muscle, right? And you can do this like in kneeling too. I may have a photo on that later, but just a kneeling hip flexor quad stretch. You can find it online. Super simple, right? This guy on the bottom left, he actually has the stretch strap or some type of stretch cord. He's lying prone, right? He has his knees together, right? He has that posterior pelvic tilt to where he isn't going to be arching his back, Because what happens if he doesn't, right? Like, let's say he pulls that heel up towards his butt, right? And it starts to arch his back. Like, he might be getting some of the quads, but if he were to do that posterior tilt, right? Tucking his tail in, bringing that belly button away from the table, like using his pelvis, then he's definitely going to be feeling a hip flexor and quad stretch. Well, the guy on the right is doing the bottom right. He's actually foam rolling his vastus lateralis, right? So he's not on top of the foam roller to where he's getting the front of the thigh, nor is he on the side to where he's getting what people think is the IT band, right? He's going right in between, and that's where your vastus lateralis muscle is, right? So if there's two things that you walk away with from having knee swelling to clicking, cracking, whatever, if you're watching this video, you need to know what the rectus femoris muscle is, and you need to know what the vastus lateralis muscle is, how to loosen them both up. And I've already told you how to do that, right? People who are foam rolling the outside of their leg, like the side of the leg, thinking they're stretching out the IT band, you're not doing anything, because the IT band doesn't actually stretch. The IT band has a finite length, meaning it can't shorten, it can't lengthen, right? But the muscle that can, the muscle that's pulling on the IT band can, and that's the tensor fascia lata, right? I'm gonna actually spell this one out for y'all, because this one's just, it's spelled weird, and I actually hate saying it, so I just end up saying TFL muscle, right? But it's TENSOR LATAELATEA, or AE, tensor fascia lata. I may have spelled lata twice. Hold up. FASCIA. That's fascia. My bad. So tensor fascia lata. Yeah, so that muscle it's also connected to the front of the hip, the front outside of the hip, and that's where this guy is targeting, as well as that vastus lateralis. He's foam rolling from that top hip all the way down to the outside and bottom of the knee. All right, I'm gonna spell that out one last time, because I know I confused some of y'all. I confused my damn self. All right, so it's TENSOR fascia FASCIA, right, and lata LATAE. All right, so there's really three muscles you guys are going to be walking away from, but really the primary two are rectus femoris and vastus lateralis. Those are the two muscles you want to loosen up. Now, for those with patellar tendonitis, for those with knee OA, maybe even for sure those with knee replacement, you're going to want to know these three exercises, because these three exercises are going to save your life. I'm not kidding. You'll see. So what you want to do is go ahead and get yourself some adjustable ankle weights, right? You can go ahead and get them from Amazon, Paragon, Dick's, Models, Target, what have you. Anywhere where they have adjustable ankle weights, right? From maybe from 1 to 10 up to 8, I don't know, like anything where you can just go ahead and add some poundage, take off some poundage. If you don't have this, if you want to be more resourceful, you can just pick up a bag of like dry rice or dry beans, make sure, it's a bit hefty. You can go ahead and like wrap that around your ankle, use a belt to like latch it on. Go ahead and add more bags or add more weight to it as you so please. But what you want to do is find a moderate weight, something that's not too light, right? Just something with a little bit of pull. I like to start with like, I don't know, like 2 pounds, 2 or 3 pounds, sometimes 4. Some people have like worked up to 4, and you're gonna get that around your ankle, right? You're gonna be sitting upright from the top left down to the bottom right. You're gonna be sitting upright. You're gonna have that ankle on. You're gonna be sitting, directly bolt up, and you're going to kick that leg out. You're gonna hold that for about like 5 seconds, 5 to 8 seconds. In this position, you can put on a lot of weight on that ankle, right? Like you can just get that quad to just go, right? Because there's not much room for it to work against gravity, right? Because you see this guy at the top left, if he brings it down halfway, gravity is going to be helping, the rest of the way and like bringing that leg down. He doesn't have to do much work to go against gravity. But if he keeps it fully extended, right, all the way at the top for about 5, 8 seconds, like that's something different, right? And he's going to have to do that 8 to 10 times, 4 to 10 times. So we're looking at, from 24 to 40 reps there, right? I say go at your own pace. You might try to rep it out, and your quads are just going to be burning. You're going to feel like you can't do anything the rest of the day. You're just going to be fatigued. You might get pissed off at me, but I'm going to say that's on you. Like gauge your strength, your muscle endurance. If you haven't been exercising in a while, then maybe you should back off a little bit, you know, but don't give up on it if you get a little soreness, because I guarantee you, the moment that soreness wears off, or maybe while you still have the soreness in your muscle and your thigh, you're not going to be feeling it as much in your knee for sure. After about, like a couple weeks, I'm thinking like 2 to 4, it's brand new knee, right? And so that's just with the seated, we call these seated knee extension. You're going to have to do all three of these exercises, but I would probably just start with there just to give your leg a little bit of a warm up. After that, you're going to decrease the weight, because I'm sure it's going to be too hard to keep that a higher weight when you're doing the straight leg raise, right? And that's what the woman underneath this guy in the photo is doing, right? She's lying on her back. She has her right knee extended already. There's no ankle weight on there. Sorry, folks, but and for you, you're going to get that ankle weight around your ankle, right? A 3, maybe 2 or 3 pounder. You're going to keep that knee straight, and you're going to lift it up to where your thighs are parallel. And guess what? You're going to hold for another 5 seconds at the top, and you're going to slowly bring that down. Now, in this position, you're working against a lot of gravity, which is going to make this exercise a lot harder, right? But same thing goes, 3 to 4 sets, 8 to 10 repetitions, and you can do that after the seated knee extension, right? Pace yourself. You should be doing this. You should be able to do this, right? Like within the day. If you feel like, what, I gotta take a break. This is too much time. I've been doing this exercise, and do it later. But I'm telling you, the more that you do, the better that knee is gonna feel. The woman on the right, she's doing my favorite exercise. This exercise is like a miracle worker, right? So what she's doing, she's lying on her back. Both knees are flexed. She isn't wearing the ankle weight. It's hard to get these photos, man. It's hard to find photos, people doing the exercises that I want them to do, because I guess I just think a certain way, like I cracked the code where I know exactly like how to target these muscles in such a way, but I'm not finding the pictures. So I'm gonna get on that. The next round of videos, they're definitely going to be all kinesiodelic, but I digress a little bit. This woman will be wearing an ankle weight, and because she's exercising her right leg, in this photo, that ankle weight is going to be on that right ankle, right? Her thighs are parallel. She's going to kick that same ankle weight that she was wearing for that straight leg raise up into the air, keeping her thighs parallel. She's going to hold at the top for about 4 or 5 seconds. Really, I say 5 seconds. After 5 seconds, she's going to slowly bring it down. When I say 5, it's not 1, 2, 3, 4, 5. Like that's too quick. You're not giving your muscle enough time under tension to really take that weight in and say, you know what, I got this. And that's what you need. Like you really need, some real like strengthening going on with that knee. You need to stress it. And that's what this takes. I did this exercise with one of my patients before, and man, it's hard. Like it really have my thighs like going. And I do squats at the gym, but again, like we're stressing the muscle in a different way. And for those who just, want to be able to like walk around a little bit, again, want to get back to like some regular exercises. They may not have stressed the knee in such a way, but this is like the easiest way to do it. No high compact, no high impact exercises. Just super simple. After a while, though, you can definitely move up because you're going to find at some point you're able to do straight leg raises for like 10 pounds, right? You're going to be able to do these supine knee extension eccentrics. That's what the woman on the right is doing. Supine knee extension eccentrics, right? With like a considerable amount of weight. And at that point, I say just go ahead, get up on your feet, and that's where we get into the next group of exercises where you could just be like stepping onto a short step. The woman at the top right, top left, she might be stepping onto something about it's not 6, maybe about a foot off the ground. You can start off with something 4, with a few weights in your hands, and she's stepping up. She's going to slowly step back down, right? She can be holding at the top, right? Not with the knees slightly flexed, right? She's not going to lock those knees out just to make sure that that knee is constantly getting some tension. She's going to slowly step down and do that all over again. You can go into a split squat, what the guy at the top right is doing. He has one leg behind him. He's going to slowly bend both knees, keep his body upright, and come right back up, right? Well, let's say you're doing this exercise and you have knee OA, right? And you're like, man, if I try going all the way down, I get the pain. Like I felt like, I was getting stronger. What happened? You went too far down. That was it. You just went too far down. You went so far down that those two bones started to grind against each other again, right? So what you need to do is continue to do the exercise, right? So that quad muscle will work that much greater next time, and there's less space, and then you'll be able to go further down, right? But that's what you need to do is just constantly assessing and reassessing. But that's what you do. You keep strengthening that quad, keep going. The guy at the bottom left, he's doing some wall sits. This is great for the quads, like in terms of just getting that muscle endurance. I had one woman doing this, and man, I think it was just after like four weeks, and I'm talking like she's like in her 70s or so, like was able to hold it like longer and longer and longer, right? And I don't know. I'd say for anyone at that age who isn't necessarily in like great shape, this is like a wonderful, easy exercise. And again, you don't need to go as far down as this guy is going. You can go halfway if you wanted to, or you're gonna feel it. You just walk your feet out away from the wall, put your butt on the wall, let your back rest against it. For some people, I might recommend like putting a small chair back there, like a stool or something, maybe like a physio ball, to where, if your legs get too tired, you can just go ahead and sit on that, you know. But again, you don't have to go that far down in order to get these muscles going. But over time, you should be, because those muscles are going to feel a lot stronger. You should be able to do a lot more. You don't necessarily need a wall to do any squats, though. That's what the person at on the bottom center is doing. You just need to be aware of like how you're making those movements, though, right? So most people when they squat, most people that I see in the clinic, right, and I'm saying most people I see in the clinic because those I see outside of the clinic don't have pain. It's the ones that are coming to me who are doing these faulty squats. They're doing squats with faulty body mechanics. What they tend to do is they tend to bring their knee past their toes. Now, I'm not saying it's a bad thing, right? Like I know a lot of people who can be doing this and they have no pain in their knee, but for those who do have pain, it's too much of a bad thing, right? And what you need to do is go back to doing some stretching, right? I go check out like my mobility videos, right? You can stretch out the gastroc, stretch out the hamstrings, you know, get more of your hip flexors, your quads, some of your spine, to where you can bring that hip behind you and try keeping your chest upright, right? You see this person, they brought the hips so far back that their toes start to come out. That's normal, right? And then you just shift your weight a little more forward where the toes are down, and then you can go ahead and just bend at the knee. All the squat is just bending at the knee, right? So again, you just constantly strengthening those muscles. And any of these exercises, you're gonna squat down, you're still holding about 3 to 5 seconds, 3, 4, 5 seconds. I'm jumping around with that number because everyone's different, right? And you come back up slow, right? No, actually, you go down slow, but you come back up as fast as you want. Um, yeah, 3 sets of 10. You know, you're doing 8 to 10 repetitions. This is some higher level stuff. Like by the time you get to this, you don't need to do the other stuff, but you know, you still might want to. Um, the woman at the bottom right, she's doing some Bulgarian squats. I tutored a guy. He's around like 52. He got in some um, like snowmobile accident. Like knee was just shattered, right? So when it came to me, I started him off on the other exercises that I showed you, the main three, right? The straight leg raise, the seated knee extensions, the supine knee extension eccentrics. I got him off on those. I put him through the same program, this very same program, and he was able to get as deep as the woman in the photo. But that was not the case when we started. His quad was completely atrophied, like just gone, right? Like 50 something year old man, like dude's quads were like, man, he was like 80. He had the quadriceps of someone 80 who was like stuck in bed all day. You know, his other leg didn't look like that, but again, like he took it so easy. It was super tight, that quad, super weak. And he was able to do this, no pain, right? Like dude was like super happy, like being discharged from the clinic, like stoked. And that you could have the same result, but you gotta put that work in. He spent maybe like 2 months with me. It might have been like 2.5 months, right? So you know, keep a log of how much you're able to do sets, reps wise. Keep a log of how much you're able to walk, go up and down stairs, you know, things like that. Like track your progress, because you know, after a month or so, you might feel like, man, like I'm getting better, but damn, like I still feel it. You know, check back to see if those quads are tight. Are they? And how do you know? Right? You still doing that posterior pelvic tilt? You're doing that stretch correctly? You're still foam rolling? You know, are you still sitting with your knees extended, right? um you know, for those with the patellar tendonitis, with that knee OA, you know, are you really doing enough resistance training, right, to get that quad going? Like always check in, but definitely keep a log, because what you're trying to do is just reverse that slope, right? That same slippery slope that I mentioned earlier, right? And that's going to be, are those muscles loose? And if not, loosen them up, because you can't do any strength training if they're still loose, right? You end up trying to strengthen them, then you're just going to fall into that same pattern. You're going to be just stuck, right? But if the muscles are loose, if the muscles are strong, you're going to be able to do whatever you want, no pain, like just not happening, right? Do whatever you want, right? Yeah, from there, man. Happy knees, happy evening. Go out dancing. You know, do whatever you want. You know, you can get back on the bike. You can get back into running, get back into swimming, right? But let's say you do that. Let's say you get back into cycling and that pain comes back. Do you freak out? No. You come back to this video, right? Because you're probably still stretching, you're probably still doing a lot of strengthening, right? But remember, you had to do that just to get to status quo. Now that you're getting on the bike and you're tightening those muscles again, you got to do a little extra when it comes to stretching, when it comes to foam rolling. You gotta do a little extra when it comes to strengthening, right? So, if you're falling into the same trap where you got, some weaker quads, go to my strength training video, review. Go back to my mobility video. Make sure you're loosening everything up. You're staying loose, right? So for some people, they're still gonna have some feelings of tightness. It doesn't like happen overnight. I'm talking about some success stories that occurred over a period of a couple months, right? Like they're still gonna get those flare-ups, right? The knee can swell, right? You can still get that feeling of tightness. You're still getting that inflammation, right? So a couple of things you can do, just go ahead and make yourself your own ice bag. If you got an ice bag, cool. You want to put that directly onto the knee, right? Like right where the pain is. That's where you want to put that ice. And you can use heat at the same exact time. Well, you're not going to put that over the knee. You're going to put that over your quads. You're going to put that over your hip flexors, right? Because that's where those muscles are, right? So that ice is going to be your natural anti-inflammatory agent. Like it's going to bring that swelling down. It's going to help to decrease, like the pain that you're experiencing. But the heat is going to get those muscles to become more extensible. That is more flexible, more mobile, right? So you can do both. Put that rice into a sock, a little gym sock. Tie that up, throw it in the microwave, you know, wait a couple minutes and slap that on. You might want to put, like a protective layer down. You're not burning anything, but like for sure, that's an easy heating pad. You get the Ziploc bags, right? You pour a little rubbing alcohol in there, a little bit of a little dish liquid, some water. You could freeze that or try to freeze it. It won't. It'll get really cold though. And by the time you take that out, it's already into a second Ziploc bag so it doesn't spill. You can slap that right on your knee, right? It's gonna stay cold, right? A little longer, than probably not longer, but it'll be able to conform to your skin, to your bones, right? And you can get some direct contact like surrounding your knee. The last thing I want to throw out is this pill, the supplement. This is curcumin. The curcumin is, a natural anti-inflammatory agent, right? That I've recommended to many of my patients because man, this stuff works. And there's different brands out there, but Nordic Naturals, just man, like I've had a lot of success. I've had patients have a lot of success with this brand. So Nordic Naturals Omega Curcumin. You want to try that out. And you can always try your own brand. You might have a brand that I never heard of or something, but definitely use that. I say by and large, man, you can use all the ice in the world, all the heat in the world, all the curcumin in the world, but you got to do some type of movement. You got to do some of these exercises, if not all. You got to do some of these stretches, if not all. You got to do some foam rolling, right? Like movement is always going to be the best exercise because remember, for some of y'all, it was non-movement, right, that led to the problem. So movement has to be the solution. So keep moving, man. Keep moving for sure. Lastly, I want to wish you guys luck. I like to end my slides with this. The body can and will adapt in your favor, but you must lead it. If you tell your body, like it's going to be loose via all your stretching, all your foam rolling, if you tell your body it will be strong via you stressing it, right, then it will get stronger, right? So use these tips, go back, go through the video, learn what you need to learn, teach your family, your friends, show them the video, recommend them, please, like, tell them about the video, you know tell them how much your quads have burned after doing some of the exercises, how much of a difference you felt in your quads when doing those stretches with the posterior tilt, bringing that knee in. let them know, you know. You can always contact me. They got brandolakes.dpt@gmail, and that's my number. Hey, I prefer you text. I might have like a number of people trying to call, and I have to explain these things. So just go ahead and send that text, man. I'll respond for sure. And if you want more information, you want me to, create a slide for, like wrist pain, shoulder pain, or something, like let me know. But I'm acting off of the people. You tell me what you need, I'll deliver. All right, y'all. Um, Logging out now. Y'all have a good day.